The current solution to opioid overdose is through a nasal spray of naloxone. The shortcomings of this solution include that it cannot reverse overdose during sleep, kids or elderly may not be able to communicate that they're overdosing, and it mostly requires the assistance of somebody else to intervene. Our current Pretotype is a Trigoderm patch with paper imitating the bionic sensors that will be part of the patch. The patch will display the name of the drug and its dose when dispensed.
No, this is exactly the size I pictured, right? It's probably about the same size as a fentanyl patch. I think any bigger than that, patients start to feel like their whole arm is kind of taped to something and they don't like it. Honestly, I think the size seems pretty appropriate. And the relative scale of the chips that would be at the corners, I think that's pretty appropriate too. So yeah, I think you guys nailed it on what the dimensions and the schematic would look like for sure. That's a good question. I think in the fentanyl patches, it's like a white colored text. It's pretty light, and honestly, you have to get like really close to it to see it too. So I think like almost like a white font, which is hard to draw per se with a marker. But I haven't seen any that like adapt for different color skins. I think it might just be, for most patients, it's like a small, it's not even this big too, the text fonts, but it's big enough that like if you go into the hospital, a healthcare provider can like look at it and say, oh wow, I guess you're on a medicine. There's probably a way to make it the right color white font in reality, if that's what we were doing.
Okay, so typically the font is white.
I think so. I'm trying to think back. I think on fentanyl patches and I think some other patches, I think they are white too.
Okay, cool.
Yeah, it's important though to have the name on it, which is something I'm glad you guys thought about too.
And then we kind of came up with 20 milligrams because we thought, you said it had to be higher than the spray, which was like 4 to 10.
Right.
And then the pill was 50, so we kind of picked something in the middle.
I think that's, your guess is as good as really anyone else's out there since it hasn't really been officially studied. So I think that makes a lot of sense. Now the fentanyl patches, like most patches have like a per hour rate because it's dispensed all the time, and this is more of like a demand one-time dose. So I guess you start getting a lot of writing if you put naloxone one-time use on it, 20 milligrams or something to make it seem like if a healthcare provider looked at it, they don't think the patient's getting 20 milligrams an hour or something like that too. But that's a minute side discussion for another day, I think too.
Okay.
But yeah, I like it. I think you guys kind of nailed what the look would be for sure.